Did you know that cough is one of the leading reasons parents take their children to the doctor? Here are some proven ways to ease your child's cough at home and how to know when their cough is serious enough to see your pediatrician. At Eugene Pediatric Associates, providers see their fair share of coughs.
Every time a kid starts coughing, parents wonder, ooh, is this a cough I'm supposed to call the doctor about?
Pediatrician Dr. Pilar Bradshaw says an occasional cough is normal and serves a purpose to clear irritants like dust or mucus from the airways. However, when a cough persists, is barky, harsh, makes it hard to breathe, or is accompanied by other symptoms, it needs medical attention.
The coughs that we want you to call us for are coughs in a child who is very young, 6 months and under, that's persisting, coughs that are accompanied by high fever and lethargy, coughs that are accompanied by chest pain or pain when kids are moving, coughs that are associated with lots of productive wet phlegm, or coughs that are accompanied by shortness of breath or difficulty getting your air.
Milder coughs can be treated at home. However, over-the-counter cough medicines are not recommended. For children over the age of 1, try some honey dissolved in warm water. Do not give honey to a child under 1 year old. For children 2 years and older, rubbing a thick layer of mentholated rub on your child's chest can be effective. And be sure your child is drinking plenty of fluids.
When your kid has a bad cough, remember to really hydrate your child because that fluid will help the mucus be thinner and easier for your kid to clear.
Talk with your pediatrician if you have any concerns about your child's cough and cold symptoms, and learn more at eugenepeds.com/healthykids. I'm Kelly Warner.